Conversation on the challenges and barriers for those living in poverty or near poverty in Chautauqua County. I'm WRFA Public Affairs Director Julia Ciesla-Hanley. According to the 2020 census, 28.1% of the population in Jamestown lives in poverty, with 17.2% living in poverty in all of Chautauqua County. Helping those living in or near poverty is something many agencies in Chautauqua County are involved in. Chautauqua Opportunities, also known as COI, is a community action agency that was created in 1965 as part of President Johnson's War on Poverty under the Economic Opportunity Act of 1964. And in 2016, the City of Jamestown received $1,180,000 from the state for a 5-year Empire State Poverty Reduction Initiative. The city contracted with the United Way of Southern Chautauqua County to plan, implement, and evaluate programs aimed at reducing poverty. Our panel tonight includes guests from COI and the United Way, as well as another guest who also works directly with those who live in poverty. But first, I would like to thank those of you who are listening to the program on our airways on 107.9 FM, as well as those watching online. While we don't have an in-person audience at this event, those watching online are invited to submit questions for our panel using the comments section. If time allows, I will then ask those questions. Please keep the questions brief. Also, this program is made possible through funding by the Corporation for Public Broadcasting's American Rescue Plan Act Stabilization Grant Fund. And we'll start now with introducing you to our guests. To my very far right we have Amy Rohler, who is the Executive Director for the United Way of Southern Chautauqua County. Next to her, we have Amanda Straight, who is the Deputy Director of Housing and Community Development for Chautauqua Opportunities. And to my immediate right, we have Elia Sostre from Southern Chautauqua Federal Credit Union. She is the loan officer there. So thank you for all of you for being here tonight. We have a lot of topics to get through on this issue. And I want to start first with Amanda, because being at COI, what would you say poverty looks like here in Chautauqua County?
Thank you. A lot of times when you hear the word poverty on TV, you see a picture of somebody with ripped clothing, living under a bridge with a bag on their back. Yes, that can be what poverty looks like, but that's not generally what you would see. Poverty can look like a single mother with 3 children that's working 3 different jobs, trying to fight to find childcare. It could be a single individual that just got hurt at work and isn't eligible for certain benefits and is waiting for their disability to kick in. Poverty doesn't necessarily come in one form, but it has a feeling attached to it. It's a fear of not knowing what the right decision is to make. Should I pay my electric bill or should I buy food for my children? Am I going to have enough money to make it to my next paycheck? So yes, poverty can look a certain way, but I think it's really more important to focus on the feeling that comes with it. So,
Elia, what would you say from what you've seen, what poverty looks like here in our county?
I would say working at Southern Chautauqua, I've seen people that come in that minimum wage is really not enough to be able to have a rent payment and pay your bills and be able to have a car, pay insurance, you know. I've had people that are on fixed income, you know, that also can't afford to have transportation because of that. So I've seen a share of people that come in looking for payday lending, you know, because they can't make ends meet even if they have a job.
That is, thinking about when you say fixed income, is that like Social Security,
Yes.
like so senior citizens who have worked?
Yes, yes.
Okay. All right. Amy, so obviously you work in a United Way, you see a lot of things throughout the county. What would you say poverty looks like in our area?
I mean, I think both Elia and Amanda made really great points that sometimes poverty means you're working, that you have an income, but you may still be below the federal poverty line. Or sometimes when we think of poverty, you might think of generational poverty. somebody who's been part of a family that's been on public assistance for a long time. And that, again, like you see that in Chautauqua County, but it can be seniors who, a lot of seniors live in poverty in Chautauqua County because they do have that fixed income, and the pension or the Social Security that they've gotten isn't enough. I think poverty can look like, single heads of household. It's almost impossible to make ends meet if that's the family composition for poverty. And it's a lot. I mean, think about this. You said the statistic at the beginning that in Jamestown, if we focus on Jamestown, 28% of households in Jamestown are in poverty. That's 1/3 of all of the households in Jamestown. That's just below the federal poverty line. When you add in financial hardship, which includes what maybe we've traditionally called the working poor. At United Way, we call it ALICE, Asset Limited Income Constrained Employed. I don't know if I should say that again. Asset limited. So maybe they have a car, maybe not. Maybe they have a house, maybe not. Income constrained, but employed, working. When you factor in those households, it's actually 57% of households in Jamestown that are in financial hardship. What we would say is financial hardship. And in Chautauqua County, it's 48%. So half of households in Chautauqua County are at any given time either below the federal poverty line or struggling to make ends meet. Sometimes one crisis away from being in poverty or having to make really complicated decisions, like you said, about paying the electric bill or buying food, and then you factor in, sports equipments for kids and books and all of those extra things that sometimes, public assistance benefits and actually often don't cover. It can be challenging. I'm part of the Jamestown School District. That's where my kids go, and 72% of families qualify for free or reduced lunch. Which means all of us have access to that. And so that's a huge portion of youth and families in Jamestown that are affected by having to make sometimes very complicated financial decisions, very hard decisions. So poverty looks like a lot of different things, maybe is what we're all kind of saying.
Right. So moving on to get into some of the other questions. According to the 2021 Child Care Resource Network study, once you get outside of the metro areas of Jamestown, Dunkirk, the town of Chautauqua, the town of Hanover, much of Chautauqua County is considered a child care desert. And so how does accessing child care affect those in poverty or near the poverty line? And Elia, I'm going to start with you on this question.
Okay, so I have coworkers that have little kids. Mine are all grown. Thank God for that. But my daughter, I have a son that have children as well, and they encounter issues when having to keep a job because of childcare. Because, we don't have many certified providers that can provide childcare for you. So then you're pushed to go with somebody that's not certified, that is also not reliable, okay? So what happens when that person, that is supposed to take care of your children does not show up? Then you miss work and you lose that job. Also, I would say along with that, it's having transportation, because sometimes you may have a child care provider, but you don't have a way to take your children to that establishment, so that way they're taken care of, so that way you can get to your job.
And that, and so if you can't get to the job, then you can't pay for the child care, and it has this cascading effect.
Yes, and I know that we have programs that help if your income is a certain amount with childcare, but if you don't qualify, then you're left paying $150 to $300 a week for one child. And you put on top of that, you know, that most jobs here are, the minimum wage is really low. So it's hard. I can see, you know, where people really see an easier choice not to work than to be, you know, to have those expenses.
I'm going to go to Amy next on, when it comes to, you know, to childcare. I mean, this is what Elia is talking about. I've heard of this story before, and you've talked about it as well. I think something, I think I've heard it when a benefits cliff is one of those things that affects childcare. But what else are we seeing affecting childcare for those in poverty?
So I think Elia mentioned it, but the fair market rate in Chautauqua County for an infant is $295 a week. So that's really, you know, that's expensive for any family. Now imagine you have 2 children in childcare, and maybe one's, you know, 3 to 5 years old, but you still have full-time daycare for your children. That's very expensive. That's a large portion of your income, depending on what it is. So that's difficult. Now, New York State has recently raised, you know, if you are 300% above the federal poverty level, you qualify for a subsidy. And that's actually pretty significant. I don't have that number in front of me, but I want to say it's somewhere around $82,000. You can make $82,000 here in Chautauqua County and get some help with that. So that's great. That's great news for families. That's great news for working families. But you also said that Chautauqua County is a child care desert. So even if you have the funds and you get the subsidy, now you have to find a place where you can put your infant in childcare. One of the programs that we support through United Way, we actually support 3 different child care facilities. And one of the reasons we do that is that it's very expensive. And so because those child care facilities get United Way funding, it makes it a little bit less expensive, we hope, for those working families. But the YWCA, we recently had a conversation with their executive director, and they have a waiting list for infant care. And she said that most of the infants will actually age out before there's an available spot for them, because there isn't that many spots here in Chautauqua County. And then you throw in if you're in a rural community or, you know, somewhere where there isn't a licensed child care facility, or you can't find a legally exempt provider that you're comfortable with. It's sort of like between a rock and a hard place, right? Yeah. But in order to work, you have to have child care. Yes. There's no way out of it, right? So it's a really tough spot to be in that really, I would say all families experience, whether you're in poverty or not, or you're an Alice family, or you're someone who's stable with a stable income. Childcare is just a really, really huge issue. And frankly, most childcare workers themselves are in poverty or Alice, because it's very expensive to run a daycare center without some kind of help from the state. Right. You know, that's one of the reasons that I think a lot of folks are doing advocacy work on a state level to change some of the support that child care facilities get from the state, so that they can pay and find workers and trained and qualified workers to care for our children. But without that it's not a great business model, to be honest, right. Childcare. So it's hard for the childcare workers, and it's hard for the daycare owners, and it's hard for the parents, and then to add one more fun thing to the mix, I guess, is let's say you work a job where you have variable hours. You work a retail job. So maybe some weeks you're 20 hours and some you're 32. And well, then a lot of childcare facilities, they kind of want your child full-time. You know, they don't want you a couple hours here and a couple hours there. So then there's some choices you have to make. But sometimes you actually go in and out of qualifying for the subsidy because you might make too much one week. And then the next week, you sort of are within the proximity to the subsidies. And so it becomes kind of complicated. And it's actually not really that easy to apply for either, the subsidy. Not as easy as maybe it should be. So it sounds like so dire, I guess, but there's a reason you brought up that question first,
Yes.
right? Because it's really a key issue that is often keeping people in poverty, because it just doesn't make sense sometimes to work. You're doing what's best for your family, frankly, by not working sometimes. Maybe that's a good spot for Amanda to
Yeah, I was going to
interrupt me.
say, I mean, I know with Amanda, you did, there are some services and programs that COI has. And I always think, granted it's for a certain age level up, I always think of the Head Start program. But, I mean, in terms of childcare, what do you see that you have available at your agency, or what are you seeing around the community in general of how lack of childcare or unaffordability of childcare is affecting those people?
Absolutely. So Chautauqua Opportunities runs the early Head Start and Head Start programs throughout the county. And we also have the Child Care Council, which works to get daycares licensed and registered and helps families find childcare. So a lot of this information is coming from their program. So there's been a 9% drop in childcare slot availability between 2018 and 2022, and that's licensed and registered. And that's 9% of a small number of facilities. So that's a huge issue. And as Amy mentioned, well, they both mentioned, the average cost for an infant care in New York State is $17,170 a year. That's more than some people make. And for a 4-year-old, it's about $15,000. So again, multiple children becomes unaffordable. And a lot of the jobs, so I live in Dunkirk, so it's a little bit different than the Jamestown area, but the majority of the jobs in Dunkirk are factory jobs. And if you're starting, you're usually offered second and third shift. I am not aware of many, if any, childcare providers that cover those shifts, the non-traditional hours, varying hours. So people are turning down jobs. And since COVID, I think most childcare facilities in the area have been struggling with staffing. So we have wait lists and we have space, but if we don't have the staff, and a lot of those staff they're not taking the positions for all of these reasons. So it's a really interconnected cycle of difficulty. But with COVID, there was a lot of money that came out to help childcare providers, so that's a really positive thing. We're working every day. The Child Care Council is working every day to get new people licensed and registered. So there is hope, but it is a huge issue.
And it's without naming names, I know someone who, is a single mom, is working and was saying, I'm waiting for my child to become 3 so I can send them a Head Start, because then I won't have to worry about how I'm working and where they're staying and the cost of that. And this is someone, that is, a hard worker, wants to work, wants to provide for their family, and is like one of those just waiting for programs, their child to reach the right age for programs so that they can worry less. So, yeah. So, and when you were talking about the second and third shift, Amanda, it flows kind of into our next question in a degree, because I think about, childcare. It keeps people need childcare because they want to work. And then just about everybody I talk to, elected officials at least, in our county, they all say workforce development is a key economic development issue, and that there are jobs here, but there's not enough qualified workers for those jobs. And so when it comes to education and what's in place, what is there in place right now that can help those living in poverty, and what challenges are there, I suppose, for maybe accessing that kind of education? Amy, can we start with you on this one?
Workforce development is a really, it's a big issue, and it's not just because of the pandemic. It was an issue before the pandemic. You had mentioned ESPRI, Empire State Poverty Reduction Initiative, and when we were administering that grant program, that was really the focus, was workforce development programs and funding workforce development programs, because we had that same issue where there were jobs, but employers could not find qualified workers. And oftentimes people could get a job, but maintaining it was difficult. Why was it difficult? Well, childcare was an issue. And that's one of the reasons. And because, your kid is sick, what do you have to do? And you don't have anyone, you got to go home and take care of them. And, you can't find a child care provider, whatever it might be. Like childcare was transportation to get, there. So that's one of the reasons that oftentimes people can get a job, but they lose it because they miss work for a variety of reasons. I will also add about childcare and Head Start and any kind of high-quality childcare program. That really is key to future academic success. So if we're talking about future workers in this county, starting them in high-quality early childhood education programs is one of the ways that we're going to build a really quality workforce. And now I know that's a long ways off, but that's one of the key indicators of future academic success is starting very early, in reaching some of those developmental milestones. So anyways, the challenge of workforce development is sort of twofold. Yes, there are the hard skills that people need to learn, where you could get a job in manufacturing and have a pretty highly skilled, position with lots of opportunity for advancement. Those hard skills are really important, but the soft skills are the ones that over and over again, that's what I've heard from employers, is I can teach them how to weld. I can send them to a certification class. I can teach them how to run a machine or, work as part of a team, on the factory floor. But what I can't teach is actually what we now don't even call the soft skills. I think the latest iteration is power skills. So that's how to work as part of a team or show up to work on time or, be part of this team that others can rely on, how to have a conversation and communicate, with coworkers, some of those skills that oftentimes I think they're harder to teach to adults, probably those social, emotional, relational skills that are really key to success and advancing. And so that's been a harder thing to achieve, I think, for employers in Chautauqua County and for programs that are attempting to teach those skills too. So that workforce development component really is key to poverty reduction, is finding ways to employ those who are unemployed and underemployed.
Elia, for the same question, I was thinking it's like, we're talking about, education. Do you see, in terms of getting the education to get into, whether it's manufacturing or whether it's, office related, are you seeing people coming in that don't have access or don't feel like they have access to education and that in your work capacity?
What I've seen working at Southern Chautauqua is people that are either nurses or electricians, but they maybe came from Puerto Rico, okay? And because they can't pass the license to be able to work here, they're unemployed.
Is it a language barrier, or is just that the test is so different from?
No, it's the language barrier, definitely, yes. I actually have a member that he came from France, and he was a truck driver there. And he actually tried to get his license here, but because he couldn't speak the language, they flunked his test.
That's something that, we always hear we have a shortage of nurses. I am constantly seeing advertisements for people for driving and a variety. And so, and here you have people who are absolutely qualified, if not for the fact that they are not a fluent English speaker.
Yes, that is correct. I also know of a registered nurse. She was a registered nurse in Puerto Rico, and here she is just a PCA because she doesn't know the language to be able to get certified to work here, even though she was a registered nurse in Puerto Rico.
Do you see, I don't know if any of you know, I mean, are there adult language classes for those who are interested in, who are coming here from wherever they may be to learn how to speak English? Do you know, I don't know if Amanda.
There are, Erie Two Boces does do some classes. There's some challenges there. So, you know, if I'm working and I want to take an English language class and I work during the day, well, when do they hold those classes? They probably are holding them during the day, and that's not going to work, you know. So I know that there are some, there's some entities that are working on doing some English language classes in the evenings and possibly through the school district as well and in school buildings. That's partially in the works. But there hasn't been, and JCC also, I believe, offers, or it has at points offered English as a second language courses. But I wouldn't say that they have been over the years really, really like robust or well attended. And maybe that's a generalization. The pandemic was also pretty difficult on a lot of those courses too.
Sure.
Where they just couldn't have them for a period of time. And there were some restrictions on meeting in person and that kind of thing. But there are employers I've had conversations with who are willing, they have a group of Spanish-speaking employees. They want to develop those employees so that they can become supervisors and learn more skills. And they're willing to have someone come in to the factory, teach English after they're done with their shift at 3 o'clock. They would pay them to learn English if they wanted to. But the challenge was finding a program that did that.
Right.
But they were willing to pay for it. And so I had a series of conversations trying to connect them and see if we could be creative. And I'm not sure whatever happened with, if they found someone to do that or an organization that would do that. But I think employers are realizing there's a real they have some fantastic employees on their hands that have real potential, and they're willing to invest in them. But that language barrier is one of those things that has to be overcome in certain settings.
And to just tie into that really quick, a lot of the positions that are hiring right now for higher level work, they require a degree. And if you're coming from a different area and you don't have the education, that is a barrier, because sometimes there are requirements for that job, that experience, that unfortunately that doesn't count. So one thing that I read, that there's an Excelsior program through New York State. So if the family makes less than $125,000, you can get free tuition to a SUNY school. And I think that was 2017 when that started. So it's a wonderful opportunity for people to get the education that is otherwise unaffordable. But what we see is in New York, because the education is higher level than other areas, I'm not sure if that's still the same, but people get the degrees and then they move out of town. We have a lot of people that get teaching degrees and nursing degrees, and they go somewhere else. So that's a difficulty as well. But there are programs. In Dunkirk, the P-Tech program is great. They built a school specifically around it's welding and electrical and manufacturing, and that has been very successful.
That's a fantastic program.
So, but thinking about, I was debating about whether I want to move some of these questions around, but I think I'm going to keep in order, keep on track. So talking about New York State, Governor Kathy Hochul and the New York State Legislature I think they're still trying to work out on some kind of agreement when it comes to this housing plan that the governor proposed to add 800,000 more housing units in the state to try to address affordable housing issues. Would you say Chautauqua County lacks affordable housing, and what other issues are there when it comes to housing if you're poor? Amanda, I'm going to start with you.
Okay. It is probably, and this is probably biased because housing is my world, but everything is so connected, but housing seems to be right now one of the most difficult issues for families in this county. Post-COVID, everything skyrocketed. There are apartments right now 1, 2 bedrooms for over $1,000 a month that don't include utilities. That's unaffordable for people who, 2 adults who work in a household. So landlords lost a lot of money during the pandemic. There was this notion that people didn't have to pay their rent, when really you didn't have to if you had certain circumstances, but it was taken as, I don't have to pay my rent because I cannot get evicted. So once the eviction moratorium was up, we're having families come in that owe over a year worth of rent. And yes, there were, great programs that could help, but once that funding was exhausted and people are getting evicted, this is a very small community. So finding another place to live that was affordable, we are seeing families and individuals staying in shelter that are homeless significantly longer than they ever have. There's a lot of issues with that. In addition, not only do we lack just regular rental apartments, we have a really dire need for permanent supportive housing. There's a lot of substance abuse and mental health concerns throughout the county, and the lack of supportive housing to support those families, it's few and far between. So I'm hoping that with this money in this plan, we can get more of those programs into our community. So there is a lot of hope. We have really great landlords in the community that COI works closely with. We run the Section 8 program, so we're working with all different families to try to find something that works for them, but there's a lot of barriers right now.
Elia, when it comes to housing, are you seeing issues with people not being able to afford housing, or finding lack of housing in the area?
I would say I've seen or heard of some landlords are asking for security deposit, first and second month's rent, when, they're already increasing the rent payment. You're talking about $900 times 3. And if they're in fixed income or minimum wage, how can you afford that, Some other landlords are requiring for you to have good credit in order to be able to qualify to get into an apartment.
And I'm thinking, when it comes to having credit, people who have grown up in poverty or are coming from poverty, do they have credit?
Exactly. They have no credit.
And that's definitely a challenge.
Yes.
Yeah. And gosh, I'm thinking, are there programs for people to help develop credit? I don't know. When it comes to, it's off topic.
You're talking to 2 people that's what they do every day,
Yeah.
is help families build credret.
Right. And it's
Yeah.
like, I know
Not
that's
the-
not part of this question,
Yes.
but it does play into it in a sense, because we're talking about housing. We they talk about, you have to have good credit when you want to buy a house, but now we're talking, you have to have good credit to rent.
Yes.
This is, and housing is a very basic
Yes,
need.
there's definitely programs that help you build your credit, rebuild it. We have programs like that, but it takes time. The minimum, the shorter one is 6 months. So if you're looking to get housing, then you have to wait 6 months to be able to have some sort of credit payment history, because that's what obviously these landlords are looking for. They wanting, probably because of all the COVID situation and all the time that they weren't having that income, they want to make sure that the new tenant has some payment history somewhere, But if they don't have any credit, they really can't afford to wait and build that credit.
Generally speaking, people pay their housing first if they can, and paying a rent payment is not counted on your credit. So
Right.
your credit score could be horrible, but you could have years and years of on-time rent payments, but that's not captured there. So that is a difficulty that a lot of families face.
Right. Yeah, and especially if your goal is one day to buy a house, you can't count decades of rental payments.
Certain loan programs you can
Oh,
now,
you
which
can?
is great. That's something that's relatively new, but for, like Chautauqua Opportunities, we help package USDA loans for rural areas. And if someone's having difficulty, if their credit is just a little bit under, there are ways that you can use rental payment history for that. So that is one thing that's helped a lot of people. But it would be great if it could be counted on towards your credit, because really, if you can only afford one thing, keeping that roof over your head is usually what happens, so.
Amy, do you have anything you want to add on the topic?
Well, I mean, in Chautauqua County, 50% of the rental population is what's considered rent burdened. So that's a HUD definition that means you spend more than 30% of your income on your housing. So that's a challenge, right? Like, that we have such a significant portion of the rental population who's struggling. And then one thing we haven't talked about is not just affordable housing, but quality housing.
Yes.
So, many of these families who are struggling to find housing, they often will take whatever they can get. And there are some really abysmal conditions. And unfortunately, the narrative sometimes is, oh, there's plenty of low-income housing in Jamestown. Look at all this. But there's, first of all, not enough. And then when you factor in any kind of quality, where there's not broken windows and holes in the ceiling, and landlords are not required to give you a stove or a fridge. That's not a requirement. And so sometimes families move into apartments that don't have any appliances, and they have to make it work. I mean, these are all very real world situations that people are living with. And the waiting list for Section 8 housing is really long. I don't know how many weeks it is. /months/years.
Unfortunately,
But that's a great tool that exists for families who have limited income, is to get a Section 8 voucher. That helps pay a portion of your rent. And I know people personally who, because they've gotten a Section 8 voucher, their employer has offered them more hours. But they don't take those hours because they are not going to lose that Section 8 voucher, because they are not going to be able to find another apartment that costs that amount, that is quality for this person and her daughter. And so she continues to work very part-time because she doesn't want to lose her health insurance, and she doesn't want to lose her Section 8 voucher. And her company would gladly pay her more. And she would like to work more, but it just doesn't make sense for her family,
And that's one really great thing about Section 8 and other rental programs is there is an inspection that's required.
Mm-hmm.
We won't assist financially if the house doesn't pass what's called a housing quality standards inspection. And it's pretty detailed, and it's not only making sure that the family is safe, but it's protecting the landlord against certain liability. And, there's been a stigma forever on what it means to receive Section 8. I was a landlord property coordinator for 5 years for COI with 67 rental units. And this is not personal, but some of my Section 8 tenants were my best tenants. Some people that receive, there's no definition of what receiving a subsidy or being on assistance really means, because everybody's individual, but we're really working to try to remove that stigma, because it's guaranteed rent every month, it's quality housing, and it's, like I said, you have a protection because someone made sure that house was safe. So I wish that more programs did inspect, because Amy's right, it's really awful to see what people are living in.
And stable housing is also very critical to academic success. I know we're not talking about education, but when you think about what makes a student successful in school, if you have to move around all the time, or you have a situation where the housing is not quality, it's very hard to do well in school. Are you getting enough sleep? A lot of times these families are moving from school district or school to school. Oftentimes they stay in the same district, but now you're starting afresh with a whole new set of administrators and teachers, and you're behind potentially in the classroom because you're constantly moving from school to school in search of better housing often. And so that stable housing is really critical for academic success. And then when we talk about homelessness, or mental health or substance use disorder, there's a school of thought that says, if you get housing first, permanent, stable housing first, that becomes the foundation to work on some of those other really like significant barriers, to economic flourishing. So housing, is, I know, what did we decide is more important? Childcare, housing? It's the more you dig deeper into those layers, you just sort of start to see like how critical it is, and then all the barriers that a lot of our families in Chautauqua County are facing to find it.
Right.
And let's not even get into lead, right? So,
Yeah.
I mean, 78% of homes in Chautauqua County were built before 1979 or earlier, which means, and that's an important year because that's when lead-based paint was determined to be a health hazard, and they discontinued it. So chances are, most families are living in a home where there's lead-based paint, and that's okay, but if it's it's a home in disrepair or needs remediation or whatever it is, and there's a really strong coalition that's working on that exact issue and making sure that kids get tested and there's funds available for remediating. But a lot of families won't report those lead conditions because they're afraid they're going to lose their home.
We, Chautauqua Opportunities partners with the Chautauqua County Health Department, and we use contractors to remediate lead in houses with, excuse me, children under the age of 6. And the issue now, well, it's always been an issue, but the cost to remediate is significantly higher than anybody really imagined. But we are tackling one house at a time and trying to make those changes. So with the Healthy Housing Coalition, it's been really great work.
Do you know how much it costs to remediate a house right now?
It all depends, because it can be in the siding, it could be in the windows and the doors and the flooring. It just depends on the level of lead in the house. But it's very specified work, because it's not just peeling off a paint chip. It can be dust that children can breathe in, and then that has really serious long-term impacts on health and development and education. So again, everything is very connected.
Yeah.
Very connected.
I was going to say that, like, one of the things when we were talking about how important it is, I always think back to Maslow's hierarchy of needs, and how housing is one of the very, first things that they say that people need before they can start to move up. I think, was it housing, food? So it was housing, food, and I forget the third thing that was on there. But, that is, if you have housing, if you have access to food, that those are some of the basic needs you need in order to, make your way to being a fulfilled person. And, if you don't have those, if you don't have access, so I can see how that is just, it prevents a lot of other things from working out. So, and, well, some people say cars are not necessarily a primary need. I would say in Chautauqua County, they are. And in fact, when Jamestown Mayor Eddie Sundquist held his public input sessions in 2021 on how to use American Rescue Plan funds, one thing I heard, because I went to these meetings, is that people said we need better public transportation here. And when it comes to barriers, what do you see as barriers to public transportation here, or other kinds of transportation for people in poverty? And Elia, you brought up transportation a couple times, and so I want to start with you to get your thoughts.
Yes, so it's funny because I was just with one of my members that she works in Warren, and her vehicle broke down, so she was trying to get a new vehicle. Trying to just get to the credit union to complete her application was hard, because she didn't have any family, any relatives here. So she could walk, however long it would be, probably an hour walking. But I even went on the website to see if she could take a cart bus. But there was no cart bus around where she lived. She would have to call and request it. And again, if you don't speak English, then do they have somebody that's bilingual that can translate? I'm not sure. But if you don't have transportation, how are you how are you gonna get to work, you know? Especially because, and like Amanda's saying, everything is connected, everything is tied up. There's so many employers, okay, there's jobs, but they have so many requirements, right? So the people that are looking and wanting to have a job are basically forced to take whatever they can get, right? So it would be, even if they live in Jamestown, if it's in Dunkirk or if it's in Warren, that's the only job opening that they can take, you know? So yes, they may have a temporary form of transportation, but, you know, either they depend on other people to give them rides, you know, or if their car breaks down, there is no public transportation for them, you know.
Yeah, and I think, I know some people will say, well, what about Uber, what about Lyft? And I'm saying, but that's not public transportations per se. That's not, you know, something that's run, that's a privately run business, basically. So, and not necessarily cost-effective as a long-term solution.
I know that our credit union has a program. It's called the GPS program. There is some requirements that you have to meet, but we are able to help people that have never financed a vehicle before. It doesn't matter what credit you are, to help them get into a vehicle with minimal down payment.
That's good to know. Thank you for sharing that.
It's a great program and really needed because it's not just, even purchasing a used vehicle, it's very expensive and there's not that many of them. So almost, I think every household has to get a loan to purchase a used vehicle. And having one that's high quality is really important because you don't have the money. If it breaks down, you have to fix, you know, this or that. It kind of nickel and dimes you after a while. You know, that's not usually the most cost-effective way to get a vehicle. So that program that they run at Southern Chautauqua Federal Credit Union really is meeting a huge need, I think, for working families that don't have access to a vehicle or they don't have a down payment or they have very little credit or bad credit even. It's really important.
So, and I guess, I don't know if you had anything else you want to add, Amy, but also I was going to ask Amanda if you had anything that you're seeing, you know, when it comes to public transportation or just transportation issues in Chautauqua County.
I'm going to share a story from our health services director, Health and Family Services. UPMC, the hospital in Jamestown, receives people in their emergency room from surrounding areas, including Cattaraugus and Allegheny counties. If someone is transported from Dunkirk to UPMC, which it took me about 35, 40 minutes with the traffic today, if they're transported and they're not admitted, they're stuck there. There's no way to get them back home. So there's 945 and 941 orders. So if there's a mental health crisis and the police transport them up there, they leave them there and then they go back. So this is causing people to not want to access care, mental health, medical appointments. We had a cab company in the county that recently closed, and thankfully we have a few individuals that are starting cab companies, but they're 1 or 2 vehicles, so the need is not being met at this time. But it really is impacting people's ability to get to what they really need, on top of work, on top of getting their kids to their childcare. Say that they have a tooth issue and they need to get to the dentist and they can't, you know, they're not able to get to those. So again, I know I keep saying the same thing, but it's all so connected. CARTS is a Monday through Friday program, and they don't do nights and weekends. The cost for the Uber or the Lyft, it's just unreasonable for most people. So, and being in a rural area, you need to have a vehicle not only that doesn't break down all the time, but you have to have a safe vehicle to get through the snow. So there's a lot of barriers that people face, but I think programs like the Southern Chautauqua Federal Credit Union are so necessary because there are places that you can go to get a great deal on a vehicle and you're paying a significant amount of money for a vehicle that might not be safe, which it kind of goes back to like the payday loans or the, what was the word that you said?
predatory
Yes, that
lending.
predatory lending. So it's great to see programs like that because there's so much of a need that I don't think people are aware of.
And you said everything's connected. My next question is about healthcare and including mental health care. And that is a challenge for our rural communities. And how does access affect people in our county? And I think, I mean, I say access people, I'm not even saying necessarily people in poverty. I think it affects all of us. But when it comes to people in poverty, I mean, Amanda, just to kind of keep with the thought, you gave a perfect example there of how lack of transportation affects healthcare and mental health care. And I mean, I don't know if you've seen anything else from, in terms of, do you see enough facilities being available for people who need it?
No, actually, and thank you, Jill, again, for all this information. I just learned that, when she sent this to me, that there are no hospitals in the North County that deliver babies. So they would either have to get to Jamestown or to Buffalo, which it's crazy to me. I didn't know that that was actually happening. And there's no hospitals in the North County that are doing mental health crisis evaluations. So again, if it's not close to you and you don't have the means to access it, then sometimes the choice is that you just don't. And, especially with mental health, for people that suffer from anything, anxiety, depression, the longer that it goes untreated, sometimes the worse it can get, and it affects your ability to work. It affects your ability to have relationships and communicate with people. So I know that there are a lot of plans in the work to get more services. We work really closely with MHA, and they want to help. They want to work with people, and I think we're on the right side of things with the partnerships that we make, but we could always use more.
Amy, I think you get into some of, like, I know that United Way's work with MHA on Esprit on the workforce development side. But in terms of what you're seeing with healthcare, I mean, what are you seeing in terms of access, whether, being able to access it, or is it people even able to afford it? What are you seeing?
I think there's a couple of issues worth maybe bringing to light. So there's, on one side, a lack of providers, whether it's mental health or primary care. And then again, that's sort of true for everyone who might need to access mental health or primary care services.
Even dentists.
In dentists, yeah, dentists, it's just really challenging to find those. And it's typically a little bit more difficult for people in poverty who may have Medicare or Medicaid or Medicare, mostly Medicaid, because some providers don't take Medicaid because the rates of reimbursement are lower, and so sometimes that's a challenge. But having Medicaid is a wonderful benefit, and we talked about this already with we didn't name it this, but the benefits cliff. Same situation where I may not work as many hours because I don't want to lose my health insurance, because maybe my employer offers health insurance, but the cost of it to my family in monthly premiums, co-pays, and high deductible plans make it really not worth the extra few hours a week that I might work, or the dollar raise that I might have been offered by my employer. And so I don't take that raise, or I take the raise and I reduce my hours so that I don't lose my health insurance. And then, if you overlay mental health and poverty, it's sort of very challenging. My husband works with in the mental health counseling field, and works with a lot of adults and kids in poverty. And it's just like the challenges that they're facing with mental health, poverty, family support systems, a couple of counseling appointments a month aren't going to solve that. It's an important support system to have in place. It does a lot of good, but it's an overwhelming sort of challenge to face when you kind of combine it with all of the other factors that are often at work. And I especially think of children in the situation. So, this is where we can talk about food, even though it's not one of our questions, but, but, like, food and health are really connected. And so access to high-quality food, food that's bad for you is cheaper. And then we do have some food deserts in Chautauqua County where it's hard to find fresh, healthy food. And that the long-term impacts of eating that way negatively impact your overall health. And so there's a lot of just connection between, I know we've said this multiple times, but I think it's important to realize the complexity and the interwovenness of all of these issues, because then when we think about solutions or ways to reduce poverty, I think they have to be equally interwoven and complex, because the issues are, you don't, if you just solve childcare, it's like whack-a-mole. The other one will come up, and then you're just spending all your time, doing this, and not really making people's lives better. So, I don't know, we probably didn't go enough into healthcare and mental health, but it's a big topic.
Yeah, and I want Elia's a chance to, respond. I mean, when it comes to healthcare, and access to healthcare, and I guess even if we want to include access to healthy foods in that as well. What are your experiences and what you've seen in the community?
Well, I've seen that, for example, parents having to take their kids outside of Jamestown, all the way to Erie, all the way to Dunkirk for dentist appointments, okay? If they have a job and don't have transportation, how are they going to get their kids to their dentist appointment? So then their kids are going to go without dental checkups, and it's bad for their health and actually them, their looks, for them to grow up feeling confident, that they have a good set of teeth, I've seen a lot of people that have health issues where they have to go to Buffalo like once a week. If they don't have a vehicle, I understand that I believe there is transportation for them to go. I'm not sure how that is set up so that way that if they have so many appointments, they can actually get to their appointments with that transportation. But it is a problem that I've seen, but it's related to also transportation. Where I work, how I've seen it.
That whole I think we can overuse the phrase interconnectedness because
Yes.
everything is so interconnected. And we had one more question. We even had an audience question, but we are at the end of the hour already. And I want to just before I do a sign off, if you, all three of you, starting with Elia, if you can give how to contact where you work. So Elia, how do people reach the Chautauqua County Federal Credit Union? Okay, so I work at our Jamestown branch on 2nd Street. Our phone number is 716-665-7000, really easy. My extension is 1350. I'm a loan officer, I'm a notary public. We also, I know tax season is over, but we also prepare taxes for our members for free. So yeah, just give me a call. I can help you build your credit, rebuild your credit, get you into a car. Great. And Amanda, how can people reach COI?
www.chautauquaopportunities.com. We also have Facebook, Instagram, and I'm probably missing something else. Our Dunkirk office is 716-366-8176, and Jamestown is 716-661-9430. We're open 8:30 to 4:30, Monday through Friday.
All right. And Amy, how can the United Way be reached?
I would visit our website, which is www.uwayscc.org, but I feel like I just need to say one quick closing remark, and I'm probably out of time. But But Southern Chautauqua Federal Credit Union and COI, they have programs and supports and services for families, you know, to build credit, to get a home, to have home ownership classes, to find affordable housing. These programs exist, so I don't want us to leave this conversation feeling hopeless or powerless to make changes to, you know, people who are struggling. And 211, which is something that United Way supports, is a number that is 24/7. You can text and you can find help for a number of different issues. They will connect you to an agency or a program that meets the need that you have, whether it's in mental health, finding a healthcare provider, finding a food pantry nearest you. That's 211. So there's a lot of people who care really deeply about this community and are working really hard to make it a better place and lifting people out of poverty. So let's maybe end this on a hopeful note that there's still lots of possibility for people to not just survive, but also like flourish.
Thank you for that, and also thank you to all of you for participating in this panel tonight. So, and thank you to our audience who have tuned in. You will be able to view this presentation again online for free on our YouTube channel and on WRFALP.com. On behalf of WRFA, the Reg Lene Center for the Arts, and Cranky Play Productions, thank you for being with us tonight.